The root elevator module includes 4 winged elevators we can use to both sever and stretch and twist and hold the periodontal ligament fibers. They are shorter elevators which provide more control and more comfort with wider handles. The sizes are clearly marked on the handle and correspond to the width of the blade in millimeters. These should be all of the sizes that you need for most of the teeth that you'll see in both the dog and the cat. We're taking the bulbed handle, we're putting the end into the palm of our hand, we're grasping firmly with our fingers, and we're choking up with our forefinger so that our elevator stays in line with the long axis of our hand and our arm, so we can insert our instrument between the root and the bone, applying oscillating action as we push in toward the apex of the root. And then once we get between root and bone, twisting and holding and maintaining that hold to fatigue the periodontal ligament fibers. Once some of the buccal bone has been removed, I want to take the winged elevator, picking the appropriate size for the curvature of the tooth root I'm trying to extract. I'm using the size 4 for the front or mesial surface of the root. I want to drive the blade between the root and the bone. I start on the tooth and gently slide between the root and the bone to get into the periodontal ligament space. And then I'm going to push in as I go toward the tip of the root. I want to be very careful that I don't slip off of the surface of the tooth. And so I'm going to be using my free hand to apply some safety to keep the blade onto the tooth. But I'm pushing in as I oscillate my instrument back and forth to drive my instrument between root and bone. Once I get between root and bone, then I can apply a very slow, steady twist and hold to stretch and fatigue those periodontal ligament fibers. I want to do this for more than 20, more than 30, more than 40 seconds. And once I give it a good amount of twist and hold, then I'm going to push further forward toward the apex of the tooth, oscillating as I push in, get further purchase to be able to twist and hold for more and more and more time. And I'm going to give that one more push inward, oscillating to cut periodontal ligament fibers with our blade, and then twist and hold with my elevator. Once I get movement on one side, I'll remove the elevator and I'll go to the opposite surface, the back side or the distal side of this tooth, once again driving my blade between root and bone to get into the periodontal ligament space. The root elevator module includes 4 winged elevators we can use to both sever and stretch and twist and hold the periodontal ligament fibers.